Hi, my name is Marjorie Mitchell and I'm the Executive Director of MICHUHCAN, the Michigan Universal Healthcare Access Network. As we move into 2013, I'd like to share with you some of the accomplishments and activities from our past year. It has been a very challenging year. Most of the staff and volunteer efforts have been towards the implementation of the Affordable Care Act, or the ACA, that was passed in 2010, and on educating the public on the contents of this landmark legislation and on its benefits for people like you and I. Let me share with you some specific examples of what we worked on this year. We spent a lot of time on the issue of state exchanges. The ACA requires that an exchange be developed in states, or an insurance marketplace that is beneficial to the consumer. We did a lot of work in writing letters, engaging all of you in calling and writing letters, did press conferences and op-eds. But the issue is still not settled. But rest assured, MICHUHCAN will still stay in the fight to make sure that any state exchange meets all of our needs. Second, we traveled the state to make sure that people understood the content and the benefits of the ACA. We did 43 presentations in the last 10 months to over 1,700 individuals. And we also distributed over 13,000 copies of our booklet outlining the benefits of this wonderful legislation. Third, we worked on insurance issues, basically regulation issues, including things like rate review. But another issue we worked on relative to insurance companies is that the ACA limits the amount that insurance companies can spend on administrative costs, as opposed to your health care and my health care. Now, some insurance companies in Michigan decided that they didn't want to do that. They wanted to avoid this requirement, at least for a few years, and requested that they be given a waiver. That would have meant that $50 million in rebates to people who were insured by these companies would not be given. MICHUHCAN and its members didn't think this was appropriate or acceptable. So we organized and we developed an online petition that garnered over 6,000 signatures in a very short amount of time. We also gave very detailed and technical testimony to the Department of Health and Human Services. So with our peer support of many organizations, especially the Michigan Legal Services, our strong partner in this effort, we were able to see that this request was denied. And not only was it denied, but our testimony and petition were mentioned several times in the explanation that Secretary Sebelius gave on why the request was denied. We're very proud of that. MICHUHCAN cannot do this work without you. In order to grow, we are having a campaign to raise $5,000. No gift will be too small, and every contribution will be appreciated. We'd also like to have more hands on deck for the actual work we do. So if any of the issues we've discussed are of interest to you, or if there's an issue that we are not yet addressing and you think is really important, please contact us. We would love to have you work with us, and we would love to work with you. Finally, MICHUHCAN is very excited about 2013 and the possibilities for improved health care for Michigan citizens. We hope you are too. Please join us.